Let's discuss concussion, a mild traumatic brain injury. This type of mild traumatic brain injury results in temporary disruption of brain function. Normally, brain function is stable, but a sudden impact can cause temporary neurological changes. In a concussion, a rapid movement of the brain inside the skull leads to short-term neurological impairment, often without visible structural damage. The term concussion refers to the temporary brain injury caused by the trauma. Normally, neurons function properly, but if a patient suffers from a concussion, stretching or shearing forces disrupt normal communication between neurons, leading to symptoms like confusion and headache. Patients experiencing a concussion often present with headache, confusion, dizziness, nausea, and temporary memory loss. Additional symptoms may include light sensitivity, difficulty concentrating, and emotional changes. In severe cases, post-concussion syndrome can cause prolonged symptoms lasting weeks or months. A key diagnostic feature of a concussion is altered mental function after head trauma, without major symptoms such as bradycardia, irregular breathing, or extreme hypertension. An example of a patient experiencing a concussion could be someone who was struck in the head during a fistfight and begins to exhibit signs and symptoms such as nausea, vomiting, and confusion. If this patient does not present with bradycardia, irregular breathing, abnormal pupils, or hypertension, it is likely that they are suffering from a mild to moderate concussion instead of something more severe like increased intracranial pressure. To manage a patient with a suspected concussion, provide supportive care, monitor their mental status, and transport them to the hospital. ALS providers should assess for signs of worsening TBI and monitor for progressive neurological dysfunction. In some cases, they will need to start an IV and can give additional medications, such as mannitol, if they believe ICP is present. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.